Officials say cases of syphilis are on the rise and are particularly high here in North Texas. The sexually transmitted bacterial illness can be especially harmful to newborns who contract it during pregnancy. We talked with University of Texas at Arlington's Dr. Erin Carlson about the risk to babies.
Our first question is, what strikes you the most about seeing this reported rise of syphilis cases among newborns here in Texas?
Well, Bianca, what strikes me the most is who it is impacting. So the rise in congenital syphilis is particularly concerning. There has been as much as a 9-fold increase in congenital syphilis cases. Overall, there's that syphilis cases have doubled in Texas and nationally in the last 6 years. So that alone is a significant increase, but particularly we have particular attention paid to the congenital syphilis cases and their increase. Congenital syphilis is very dangerous for a newborn, resulting in death in as many as 40% of cases of congenital syphilis. And there's also higher rates of premature birth and miscarriages among moms who have syphilis. However, if the mom is treated at least 30 days before giving birth, there is an excellent chance for survival for the baby.
Well, what do you think in terms of concern level? How concerned should expectant mothers be here in North Texas, and what can they do to stay as healthy as possible?
I don't think that expectant moms need to be particularly concerned, provided they're taking all of the preventive measures to prevent transmission of syphilis. And if there is a concern or a risk factor, that they be sure to get tested for syphilis. Syphilis is readily treated. We just need to make sure that we catch it earlier than later. There are simple blood tests that can diagnose if one has syphilis, and it's readily treated with antibiotics. It's important to keep in mind that syphilis is very easily transmitted to others in the early stages of it. So it's important to take preventive measures, use condoms when engaging in sexual activity, and to not engage in sexual activity if there's any sores or any indicators that one may have contracted a sexually transmitted infection. What expectant mothers can do to be sure that they're not passing syphilis to their child is to simply ask your OB-GYN for a test for syphilis, or go to your community health center, to your health department, or to any physician and ask for a syphilis test.
Also concerning is the age, which seems to be hardest hit by this increase in syphilis cases. Most of these new cases in Texas appear to be among men ages 25 to 34 and among women ages 20 to 24.